AFP case investigation form is an important document to get the epidemiological data on the disease. Evidence generated by this data help in development of strategies for prevention, control, and eradication of the disease. In this video, you will learn about filling of CIF for acute flaccid paralysis case. Fill the CIF for all cases having sudden onset of weakness and floppiness in any part of the body in a child less than 15 years of age within 6 months of paralysis onset, or paralysis in a person of any age in whom polio is suspected. To avoid missing of any polio case, fill the CIF for all cases having current flaccid paralysis, history of flaccid paralysis in present illness in last 6 months, and borderline or ambiguous signs and symptoms. All the cases having onset of paralysis in last 6 months should be investigated using CIF. Let's now learn how to fill the form through a case study. Here is the reported case study. You can pause the video and go through it. Let's start filling the form section-wise. Investigate the case within 48 hours of notification. All sections should be filled correctly and completely. First section is on notification and investigation information. This section is important to understand the sensitivity of surveillance system to detect the case early and to investigate the case within 48 hours of notification. Case was notified on 15 April and was investigated on 16 April. Health facility type, category, and setup help in assessing the health-seeking behavior of the community and guides further fine-tuning of the network. Case identification details are important to trace the case for epidemiological investigation and follow-up when required. Under identification details, ensure that date of birth, address, and mobile number is correct and complete. Child was hospitalized on 13 April and was diagnosed as a case of traumatic neuritis. Try to collect all the hospital records which help in establishing the correct diagnosis for paralysis. Immunization history is important to understand the level of protection that is there for polio in the child. As per immunization history, the child received 3 OPV doses through routine immunization and 3 doses through pulse polio. The last dose OPV before paralysis onset was received on 15 March. Child also has received 2 doses of FIPV. Section 5 is on the clinical symptoms. Fill the number of days from onset to maximum paralysis, type of paralysis like acute, flaccid, ascending or descending, as well as any history of injections during 30 days before paralysis onset, date of paralysis onset in 31st March, and this is most important date for all the epidemiological analysis. Under Section 6, write the disease progression in 3 to 5 sentences. Also mention about relevant negative history. At the time of examination, assess the respiratory, bulbar, bladder or bowel involvements. Joint pain or swelling and gait should be assessed. Take complete travel history for all the travels made by the patient during incubation period and write the address in the CIF. On an average, the incubation period for polio is 7 to 10 days and it ranges from 4 to 35 days. The case would have acquired the infection from one of the places where he or she had stayed during the incubation period. Based on travel history, case should be cross-notified to the district where he or she might have highest probability of acquiring the infection. Detailed epidemiological field investigation must be done in the cross-notified district. Get information from caregivers about all the health facilities visited by patient after the onset of paralysis and write down their names, address and dates of visit. The help-seeking behavior information helps in identification of all the health facilities which a suspected case may have visited. This information helps in sensitization of health facilities for timely notification of suspected cases as well as reprioritization and expansion of the reporting network. Section 9 is on clinical examination. It is an important section in AFP case investigation and should be done accurately for all the notified cases. First, access the tone as normal, increased or decreased, followed by power at every joint and grade from 0 to 5. Elicit the biceps, triceps, supinator, knee, ankle and plantar reflexes. Take the mid-arm, forearm, mid-thigh and mid-calf measurements to assess any wasting due to paralysis. Also assess that any cranial nerves have been affected by the disease. Same clinical examination has to be done after 60 days of onset for inadequate AFP cases and cases with poliovirus isolation in stool. Further, in Section 9, encircle about loss of sensation, symmetry of paralysis, site of paralysis, and whether case is a hot case or not. Any case that clinically looks like polio is a hot case. That is age below 5 years, fever at paralysis onset, asymmetrical proximal patchy paralysis or bulbar paralysis. Section 10. Provisional diagnosis is mandatory for all AFP cases. If the investigated case is not an AFP, then encircle the reason for the same. Further, encircle one of the 3 reasons for labeling the cases as an AFP. Flaccid paralysis at the time of investigation or history of flaccid paralysis but no paralysis at the time of investigation or borderline or ambiguous case. The current case is not a hot inadequate AFP case, hence this is not eligible for contact stool sampling. Section 12. Stool specimen collection. Stool sample can be collected up to 60 days from the date of onset of paralysis. Encircle reason if sample could not be collected within 14 days of paralysis onset. There should be a gap of at least 24 hours between the 2 samples in view of intermittent shedding of the virus in the stool. Sample is called adequate if it meets the 3 criteria. Here samples were collected on 15th April. A sample was discarded as it was collected before 24 hours and next sample was taken on 17th April. Once lab result is available, DIO or SMO office should share with patient and health facilities. Sub-center A&M was assigned to visit all houses in the village and search for any additional cases of AFP within last 6 months in children under 15 years of age. The A&M visited the village on 18th April and found no additional case. DIO or SMO or nodal officer should conduct the 60-day follow-up examination for inadequate cases and poliovirus cases to see whether residual weakness is present or not. This is an inadequate case as sample was collected after 14 days of onset of paralysis. Final classification is the last section of the CIF. AFP case can be classified as confirmed polio, compatible or discarded. Once discarded, the final diagnosis must be written in the CIF by the DIO or SMO at earliest. CIF is an important document for providing evidence of polio eradication. Keep all the sections updated as and when the relevant information is available. EPID number is assigned by DIO or SMO office. This is 13-digit alphanumeric unique code for each suspected case. It consists of country code, state code, district code, year of onset of paralysis, case serial number. Sensitive AFP surveillance is important for polio-free India.